Welcome to the Intensive Competency Workshop, Behavioral Sleep Interventions, presented by myself, Melissa Druskis, with ABC Behavior Training. Just to give you a little bit of my background, I have a bachelor's degree in speech language pathology and audiology, a master's degree in applied cognition and neuroscience, and the graduate certification program in ABA from Florida Institute of Technology. I have over 15 years of pediatric clinical experience. I've worked as a BCBA mentor and consultant. I have graduate level teaching experience, and I am the owner of ABC Behavior Training and the founder and editor-in-chief of Behavior Brain magazine. If you're not familiar with ABC Behavior Training, our goal is disseminating the science of ABA to everyday behavior analysts. That means coming to you where you're at to give you the tools and resources you need to do your job more effectively and efficiently. We do this through our resources. So we have experience hour trackers, competency assessments, evaluation forms, graphing templates, a supervision curriculum book set, which has recently been updated for the 6th edition test content outline. We also have an online version of that. I have BCBA planners, therapy materials, and the only parent assessment in the field of ABA. We also do this through our education. So that is through continuing education courses, Q&As, workshops, through our podcast, which is Behavior Brain Podcast, articles, and through our parent coaching certification course. And then we provide supervision. So that includes supervision for students that are entering their fieldwork hours, using a structured curriculum, which is the same one that I sell to other behavior analysts. They have lots of opportunities for unrestricted hours. They get to learn from a varied team of experienced BCBAs. And there's also group supervision opportunities with other supervisees in the program. And finally, we do this through collaboration with other BCBAs. So I offer one-to-one professional mentorship as well as behavioral coaching for personal goals. So how you can utilize ABA and have some accountability to reach whatever those personal or professional goals are that you have. I also have OBM consultation for entrepreneurs and business owners and parent coaching for BCBAs that are needing a little extra support or for families that you might work with. Now, the purpose of this training is to bridge a gap that, if you're out there working in the field, working with kids with autism, you know that a lot of our kiddos have sleep issues. But this is one area that we don't have a lot of education in that often gets missed when we're working with our families. So we're going to address that gap when it comes to an underserved area in behavioral health, which are those sleep challenges. Also, you're going to master behavioral sleep strategies. So gain evidence-based techniques to create effective, individualized interventions for sleep-related issues like bedtime resistance, night wakings, and irregular sleep patterns. You'll have the tools to support families and caregivers with actionable tools and guidance that's going to help improve their child's sleep, reduce family stress, and enhance overall well-being. And you also are going to be able to expand your role as a BCBA. You can enhance your current role by addressing a critical and often overlooked area of behavioral needs. Now, we also offer a competency mentorship, which you may have signed up when you signed up for this course and added that competency mentorship to that. But if you didn't, don't worry, you can still sign up for that at any time. And if you do choose the competency mentorship, you're going to hear me talk about it ongoing throughout these next few weeks, especially when it comes to the assignments. Because with assignments, when you sign up for the competency mentorship, you are going to get individualized feedback. I personally am going to look over all of your assignments and give you some feedback on them, so you're going to get actionable insights on your cases, interventions, and the strategies that you're implementing. You're also going to get a one-to-one mentorship meeting with myself, where you're going to get personalized guidance to help you develop these advanced skills and make sure that you have the competency that you need to go out and implement these behavioral sleep interventions. And at the end of it, you're going to get a certification of clinical competency competency, which you're only going to get through that competency mentorship. It's going to be formal recognition of your expertise and completion of this behavioral sleep intervention program. You can use it to stand out from others in the field by having this certification, or you can also use it to expand into behavioral sleep coaching. So, who is this mentorship for? Of course, it's for BCBAs, but there's 2 points to it. So, one, as I said, it can enhance your current role. So, you're going to have that ability to address sleep challenges within your existing caseload. Probably many of your clients are going to be having sleep issues, whether we have questioned or know about them or not. It's going to help us improve treatment outcomes and family satisfaction by improving these sleep issues. And then it's also for BCBAs that are looking to specialize. So you can build a niche as a behavioral sleep coach where you're supporting parents, whether it's parents of children that are typically developing or those with special needs, that you can help them with their struggles when it comes to their child's sleep issues. And you can develop these skills to grow your own practice or transition into a consulting role with this certification. So, why is it worth it? Sleep is one of the most pressing and underserved needs for families with children with autism. And honestly, it is something that's vital for many families, regardless of the developmental level of their children. If you have children, you probably have experienced those early years when you just want them to go to sleep and like they're going through all of these changes where they're waking up in the middle of the night, wanting you to stay with them, all of that, and that can be a struggle for anyone. But with our parents with children with special needs, that kind of goes even further because it doesn't necessarily stop at where the typical development normal changes stop. So it's also going to help you equip yourself with practical tools and strategies so you can create this meaningful change for the children and also for their caregivers. And you'll also be able to join a growing community of experts that are dedicated to improving family well-being through evidence-based sleep solutions. So if you want to join, there is going to be a link below this video in your course that you can still add on and join this competency mentorship. And you can also join it at any time. Just like all my other content, it's not going to expire. You can get it now and go through submitting the assignments and doing that one-to-one meeting with me and getting your certification anytime that you have a relevant client to work with and utilize these strategies with. So let's go into what we're going to be covering for this 6-week course. So we have 6 modules that we're going over. The first one, we're going over an introduction. So we'll be talking about sleep issues and what that looks like. In the second module, we'll talk about assessment. We'll look at how to assess sleep issues and utilize that to move into our third module, which is design, how we are going to create our treatment plan for addressing these sleep challenges. And then module 4, we'll talk about implementation. How are we going to actually implement this, which a lot of times that's going to have a lot of parent involvement because we are often not there when our clients are going to sleep. So a lot of parent education involved in that. Next, we will go over troubleshooting in Module 5, and then finally we'll talk about maintenance, so how to keep this progress going, especially as there's still going to be sleep changes that are naturally going to occur as the children grow and move into these different levels with different environmental changes happening in their life. Now, a quick disclosure, some of the materials and services discussed in this presentation are sold by the presenter for profit. There is no obligation to purchase anything that I talk about in this course, and this presentation is not for the purpose of selling any of the resources mentioned. And actually in this talk, I don't think that there's anything, any specific tools that I'm talking about that you won't already have access to in the resources that I'm giving you as we go through each week in the course. Now, one other thing that I want to let you know is that you are going to get access to one lesson per week. It's going to drip out one per week because I want you to have the time to absorb the information, read any articles that are associated with it, and complete the assignments in a timely manner. But don't worry, you are not going to ever lose access to it. So you'll have access forever once they drip out once a week. So I really look forward to teaching you all there is to know about behavioral sleep interventions and help you make some positive changes for your families.